Do you have chronic pain too? Maybe a chronic dry cough that doctors just can't figure out. This is Estelle, and your answer could easily be deep neck muscles that are really pissed.
Goodness,
There
Nova,
are deep
what's up?
Uh-huh.
Mm-hmm.
Oh, everybody knows to like, follow, and subscribe. Who doesn't want to power their healing? That have a huge impact on cervical stability, the longus colli and the longus capitis. Everyone knows about the trapezius muscle, especially this spot. But this is just a symptom of neck and shoulder instability. Two of the muscles involved that go inward and therefore untreated are the longus colli and the longus capitis. Both connect to the front of the cervical spine, the fancy way of saying neck, in between the spine and the larynx and trachea. Since we have several muscles on the back of the cervical vertebrae, it makes sense to protect the joints and keep them stable. We would need muscles on the front of the spine too. They do two things: neck stability for posture and neck flexion. The longus capiti specifically doing head flexion like this, and the longus colli neck flexion like this. I know everyone is thinking the same thing. But Estelle, I look down all the time and I'm told that's why my neck hurts. Yes, that's true. There is a difference between proper neck flexion like this and collapsing your neck using the SCM like this. When we collapse the neck like that, we are working our trapezius, levator scapulae, and omohyoid muscles, just to name a few, really hard. We're working them double time to keep our head and neck stable. And since those muscles are so tight, the body weakens the longus capitis and colli to protect the joints. Otherwise, the vertebrae would be clamped down on, increasing the wear and tear that much faster for them, which is not how you make friends. Now that the longus capitis and colli are inhibited, the scalenes have to work that much harder to help you stabilize. It's a horrible cycle of dysfunction to be caught in that sets a stage for things like cervical degenerative diseases, headaches, migraines, jaw pain, chronic dry cough. Oh, that's cool. I mean, not in a fun way, but let me explain. Trigger points are one of the mechanisms of dysfunctional patterns. Your body puts them in place within about 20 minutes of holding a posture and or repetitive movement. And it's just to help keep you going. And the body has to create trigger points to strengthen some muscles and weaken others. And since everything is connected, they are all talking to each other. So when the SCM gets strengthened with their trigger points, the longus capitis and colli are being weakened. And those trigger points on the capitis and colli can refer the pain just like any trigger point. And since they are just on the other side of the larynx and trachea, the brain interprets that as a tickle in your throat, and you dry cough to get whatever's tickling you dislodged. And the people that have a persistent dry cough and have ruled out other conditions like walking pneumonia or a sinus infection, etc., could easily be caused by trigger points in the longus capitis and colli. That is so wild, right? This dysfunctional pattern can also be caused by whiplash trauma. Since many people don't get physical therapy unless the whiplash is severe or they have some kind of pre-existing condition compounding the minor damage, these trigger points can become a part of your homeostasis very easily. I know I just painted a dire picture. Good news is that the body can change. First, you need to know that there isn't something more serious going on, especially if you're experiencing symptoms like pain that causes nausea, numbness and tingling, stabbing pain, and a significantly reduced range of motion. The most common test done is basic x-ray. I've seen them do CAT scan or MRI. It really just depends on the symptoms, the doctor, and the insurance provider. They might also do a nerve conduction study to make sure the nerve itself is okay. Once the health risks are ruled out, you can assess the strength of the muscles by lying on a firm surface like a yoga mat on the floor on your back. Your legs and arms can be placed wherever they are comfortable. The focus is the neck. You slightly curl your chin in and down and slightly flex your neck just an inch to two off the ground. You want to be able to hold this easily for 30 to 40 seconds. Just to give you an idea, You can cheat by lifting too high or using your SCM muscle to get the curl you need. Watch out for that cheating. If you can't hold this for 30 to 40 seconds and you have a brick wall instead of soft tissue here, or steel cables instead of SCM muscles, there is a good chance that your longus capiti and longus colli are inhibited. But don't worry, there are many things that you can do. You can get a massage. There is a massage technique that allows massage therapists to massage those muscles. Not all massage therapists are certified in the technique, so make sure to ask. You can also get physical therapy for it. And there are exercises that you can do too. So many people struggle with this that I'm making multiple videos about what you can do to rebalance your neck and endure chronic pain as long as the joints are not already compromised. Thank you so much for watching. Comment below if you have any questions.